Gladys. My name is Becky. I will be a Rhode State nurse today. The reason I am here is because there is an order for you to get an IV push of Lasix for your congestive heart failure right now. So what I'm going to do is I'm going to go ahead, organize my supplies, look at all the documentation, make sure our T's are crossed, our I's are dotted. Give me a moment and I will be right back. But first, before I get all excited, let's verify everything. Gladys over, 51851, 51851, and allergy to SOFA, and allergy to SOFA. All right, give me a moment, Gladys, and I will be right back. Excuse me. Okay, so now we're going to pretend that I am not in the room with Gladys. What I am doing is I am actually in the med room getting ready to pull the Lasix. First, I want to verify the medication administration record to the physician's order. So what I have is Gladys over, 51851, with an allergy to SOFA. I have, oh, you know what, excuse me. I'm at that age. Okay, there we go, that's better. So, first thing we're going to look at is 0.9 normal saline, 0.9 normal saline. Doctor's order states 3 milliliter flush before and after each IV push medication. So does the medication administration record. 3 milliliter flush before and after each IV push medication is to be done now. Now is the time. The other medication is Lasix, somewhere between 30 to 10 milligrams depending on weight. IV push for a stable weight of 185. If she is 2 pounds over 185, I'm going to give 30 milligrams. If she is 2 pounds below 185, I'm going to give 10 milligrams. If she is 185, which she is, current weight, just got it, it'll be 20 milligrams. So that's what we're going to do. We're going to work with that 20 milligrams. So that, they both match. And the time for the Lasix is now. So let's go ahead and do our first check. The dosage is 20 milligrams depending on her 185 pounds, which she is. The route is IV push. The time is now. The reason, congestive heart failure. The individual, Gladys over, 51851, Gladys over, 51851. The medication is Lasix. Lasix. The expiration date is January 2025. Let's move on to our flushes. What I have is 0.9 normal saline. So the dosage for these is 3 milliliters. The route is IV push. The time is now. The reason I'm giving the Lasix is for her congestive heart failure. And the reason I am giving these flushes is one before and one after the medication administration of the Lasix. The individual is Gladys over, 51851. Gladys over, 51851. The medication, 0.9 sodium chloride. Oops, let me turn that around. 0.9 sodium chloride. Oh, this is, okay. 0.9 sodium chloride. So, the expiration date is 6/1/21, and the expiration date on this one is 9/30/2020. So, now what I'm going to do is I need to know what to look for once I give this medication to Gladys. According to the book, excuse me for a second. According to the book, I do not necessarily need to dilute. No dilution needs to be happening here. I'm going to monitor blood pressure. Lasix can drop your blood pressure. I'm going to check on the routine checks on electrolyte panel, CO2, and BUN are necessary during drug therapy. And rate of administration for each 40 milligram or fraction thereof should be given over 1 to 2 minutes. So this medication and one of these flushes, I'm going to give between 1 to 2 minutes. Let's go ahead and do our second checks. Dosage for the Lasix, 20 milligrams. Route, IV push. Time, now. Reason, congestive heart failure. Individual, Gladys Over, 5/18/51. Medication, Lasix. Expiration date, January 2025. Let's do this again with the normal saline. Dosage is 3 milliliters each. Route is IV push. Time is now. Reason, one before and one after the IV push Lasix for the congestive heart failure. The individual is Gladys Over, 5/18/51. The medication is 0.9 normal saline, 0.9 normal saline, which matches the administration record. And we're going to look at the expiration date, 5/30/20 and 6/1/21. So that was my second check. What I'm going to do now is I'm going to do a quick calculation because I don't know how much to withdraw. So I know the doctor wants me to give 20 milligrams because she weighs 185 pounds. What I have on hand is a 4 milliliter bottle of 40 milligrams. We're going to go ahead and we're going to multiply, we're going to divide, we're going to end up with 2 milliliters. You got that?
Yep, I got it.
All right. So 2 milliliters is what I'm going to withdraw. But first I'm going to do my third checks. Dosage is 20 milligrams or 2 milliliters. Route is IV push. Time is now. Reason is congestive heart failure. Individual, Gladys Over, 5/18/51. Gladys Over, 5/18/51. Medication is Lasix. Medication is Lasix. And the expiration date is January 2025. Second medication is the saline flushes. So the dosage for each of these is 3 milliliters. The route is IV push. The time is now. The reason is one before and one after the Lasix for the congestive heart failure. The individual is Gladys Over, 5/18/51. The medication is 0.9 normal saline, 0.9 normal saline, 0.9 normal saline. And the expiration date is, or dates, because they're not the same, 9/30/20 and 6/1/21. Okay, so what we're going to do now, what we're going to do now is I can't really give this until I look at the IV site. I don't want to get all this stuff prepared and ready, and her IV site is bad. I'm going to look for heat, coolness, edema, redness, and pain. None of that is presenting itself right now. We're going to go ahead and withdraw the medication. Do I have? Yes, I do. Okay. Get that out of the way so I don't get confused. Due to the fact that me and my partner in crime here have been working at this all day, just getting nervous in front of the camera, I am limited. I no longer have any clean syringes or needles. We use them all in practice. So, excuse me for that. Please forgive me. So, what we're going to do is we're going to go ahead, scrub 15, 30 seconds, and that has been 15 seconds. We're going to go ahead and we're going to withdraw 2 milliliters. You know, for as many times as we've done this, I'm shocked we still have enough.
I know. I think I'd rather do this in person in the lab.
Okay. Let me get rid of the air bubbles. Every time. Okay. And let me get 2 milliliters right there. Now, I'm going to pretend, boom, that I put on the safety, but I'm really not going to, just in case I mess up and I have to redo this video again. So let's just pretend I've got the safety on, and I'm going to go ahead and set my syringe with the safety on, the needle, on top of the alcohol pad. Okay, so now we're going to get ready to administer the medication. So before I administer the medication...
I didn't mean to snap my fingers at you.
Did you stop?
No, I didn't stop.
Oh, okay.
I didn't stop.
Before I start my medication administration, I'm just going to go ahead and put that alcohol wipe there. I'm going to put this one way down so I don't use it again like I did last. Okay, so.
Oh, there you go.
Ah! You know what? I have the worst luck with these alcohol pads. I'm not kidding you. They go flying all the time. I don't know what it is about me. So I'm going to scrub the hub. We're going to act like we do this for 15 seconds. And I'm going to get another alcohol wipe out. Okay. This one, oh. Before I do that, I see air.
Good job.
Okay. What I'm going to do is I'm going to verbalize to you that I'm going to aspirate in case of the central line use or for blood draws to make sure that the blood withdraws back per agency policy. So let's go ahead and give that 3 milliliters. And it doesn't have to be over a minute, but I do like to go a little slow because sometimes with these patients, the IV blows if you go too fast. That's good right there. 3 milliliters. Done. I'm not going to use that flush again. So what I'm going to do now is, that flush is in the sharps container. So what I'm going to do now is go ahead, take the needle, put it in the sharps container, and set my, put this up against my Luraloc. And we're going to start in a couple seconds. I'm going to go for 1 minute, maybe a little bit over. Okay, so here we go. Not quite at 15 seconds. There we go, 15 seconds. I am halfway there, and I've got 30 seconds left. Okay. Got a little bit over 0.5 milliliters, and I've got 10 seconds left. So I might just run over a minute. I've been over a minute. Okay, couple seconds, and I am there. All right. Sharps container. Now, the last flush. What we're going to do is withdraw the air. There we go. Okay. Now, this 3 milliliters needs to be run over the course of a minute or more, because there's still medication in the J-loop and whatnot. So let's go ahead and start the timer. Oh crap. Get a couple more seconds, I apologize. Now. Okay, I did 1 milliliter, and that was 15 seconds. I'll slow down a little bit. I got 30 seconds. I got 10 seconds and just a little bit, about half a milliliter of saline to go. Okay, it's been a minute. We're going to go ahead, we're going to uncap. We're going to take a clean cap, which I apologize, I don't have any. We're going to put the clean cap on the IV site. Now, I can now remove my alcohol pad. I'm going to look for heat, coolness. I don't feel any coolness. It's not infiltrated. Edema, no edema. Redness and pain. She's not complaining of pain. So we did good, and the IV site is still good. So now I'm going to go ahead and document my findings, and I am going to wash my hands. Thank you so much. Have a great day.
How do I stop it? I don't know how to